All right, good afternoon, everybody, or good morning still. Yesterday, Secretary Austin and I were able to brief the President on the tremendous work that's being done to support our hospitals right now. At FEMA, we've been part of this COVID mission since day one, beginning with supporting jurisdictions with medical personnel, acquiring and shipping personal protective equipment, medical equipment, opening testing sites, and deploying federal resources in support of our state, local, territorial, and tribal members. As we approach the one-year anniversary of opening our first community vaccination center in California, just one of the thousands we supported across the country, FEMA and our over 20,000 strong workforce continues to meet the ongoing requirements of the pandemic. Our support to our partners hasn't stopped and will not stop until this pandemic is over. We know that the most critical need right now is medical staffing for our hospitals, and we've been working nonstop with the Departments of Defense and Health and Human Services, who have been on the grounds in communities since day one, to push even more medical teams out the door to communities who need it most. I've seen firsthand the impacts of these teams on their continued heroic efforts. During my time as commissioner in New York City for emergency management, at the very beginning of this pandemic, I had the privilege of speaking with the chief nursing officer at Elmhurst Hospital, which was at the time the epicenter of the epicenter in those very early days, and listened to her address the Department of Defense medical team as they were concluding their mission at their hospital. She said, with tears in her eyes, "You were the miracle we needed when we needed it most." DoD continues to deliver on those miracles every day as they stand shoulder to shoulder with the heroes working on the front line in your communities. Yesterday, I spoke with Governors Whitmer and DeWine, who both said separately that these teams, in addition to adding more clinical capacity, are a morale boost to the doctors, the nurses, and the support staff in the hospitals that they're working in. And they have been working day and night to save lives. So now, DoD is deploying 6 additional teams to Ohio, Michigan, Rhode Island, New Jersey, New York, and New Mexico. We will also be deploying an additional HHS team to Rhode Island. And in the next several weeks, we are prepared to do more. These teams are in addition to more than 1,000 staff that are already deployed to 26 states, 2 territories, the District of Columbia, and 24 tribal nations. And since March of 2020, since the beginning of this pandemic, thousands of federal personnel have deployed all over our country. As critical as our doctors and nurses are, countless other professionals keep our hospitals running. Patient transporters, food workers, and cleaning staff are all at the heart of these healthcare facilities. And so for that reason, with the President's support, I am now directing an expansion of our FEMA policy to permit funding to states who elect to use their National Guard troops to fill these critical support roles in hospitals. During every disaster, FEMA's strength is our ability to coordinate with other stakeholders, federal, state, local, tribal, private, and nonprofit partners to identify gaps and meet needs. And this COVID mission has been no different. We meet with our DoD, HHS, and other federal partners daily to anticipate future needs and fill those requests. FEMA has also been supporting communities across the country through nearly $100 billion in funding for all types of COVID-related needs, including vaccination, safely opening and operating schools and other public facilities, and testing, thanks to an unprecedented commitment by this administration. This funding, combined with the extraordinary work of DoD, HHS, and our other federal partners, has enabled states and local communities to fight this pandemic, save lives, and protect families. This pandemic has shifted and changed through the Delta variant and now the Omicron variant, but our commitment and the commitment of the entire federal family has not changed. Together, we will continue to surge staff, push resources, and provide support using every tool that we have available to fight our fight against COVID-19. Thank you. I'll take a few questions.
All right. Lisa, thank you. you, and thank you for being here, Administrator. Manpower is one thing, but I know you've talked about in the past too, having to make sure they have somewhere to work and that there are hospital beds. So for these 6 particular states and hospitals that have been identified, are you building out capacity, adding more physical space for the teams to work?
In these specific states, these 6 states, we are just sending staff. That is the request that they had. Our regional administrators have been in constant communication with our state emergency management directors and state public health directors throughout this pandemic, and we have been conducting recently facility expansion assistance to all of the states. Right now, we've had a few states that have requested some assistance in helping to identify where they may be able to expand, but we've had no specific requests to expand hospital capacity outside of maybe setting up a tent outside of their emergency room to be able to support triage efforts.
Thank you. Alex? Oh.
Well, I do have a question. You know, this has been a year of unprecedented natural disasters, as well as obviously a global pandemic that has no end in sight at this point. Are you largely relying on ARP funding, or are you hoping to get more funding from the administration going forward as we're looking at another year of ongoing challenges?
Yeah, the funding that FEMA uses is through our Disaster Relief Fund, and right now for all the requirements that we have on our plate, we have enough funding within that to meet all of those demands.
Jeremy?
Thank you, Administrator, for doing this. What kind of feedback were you getting from governors or hospitals that led to this decision and this added flexibility? And then secondly, I'm also wondering, you know, next week there's, I guess, 120 military members going as part of the 6-state deployment. That's out of the, I think, 1,000 military members that the President has said he would mobilize this coming month. So why are you only sending 120 right now at a time when there are, you know, nearly 24 states, I think, that have 85% plus ICU bed capacity? Are there not more requests coming in, or what are you waiting for to deploy the rest of that 1,000?
Yeah, great questions. And so on the first question, remind me the first question again real fast.
The feedback that you're getting from
Right.
governors and hospitals.
So again, my regional administrators, they've been communicating with our state directors daily. And one of the things that we have heard recently is, while we do need medical staffing, there's a lot of other functions within the hospital that need additional staffing, in particular because of the Omicron variant and how it's taking other staff within the hospital out. And so we've been able to expand our policy in order to make sure that we're providing whatever type of resources are available to keep those hospitals functioning. So an incredible step forward to make sure that they can keep moving. As far as where we're at with the deployment of personnel going out, the Department of Defense, through FEMA, we have been sending Department of Defense personnel out throughout this pandemic. We sent several teams out during the Delta surge, and we started to evaluate what we thought the impacts would be for the Omicron variant earlier in December. And that's where the initial announcement was made that we were going to send 1,000 additional personnel from the Department of Defense. As we get requests from our state partners for what they need, these are the requests that we have right now, and we're filling those based on when they can receive them.
Thank you for the question. So what's the point of now sending N95 or KN95 masks out to Americans if a lot of those masks are just single daily use? Like somebody wears it once, then what?
Masks save lives, I think, is the important thing here. And we want to make sure that everybody has the tools and resources that they need in order to protect themselves and their families.
Go in the back.
Administrator, thank you so much for taking my question. I just want to ask you, is there any plan, you said your agency is willing to do more, but is there any plan to set up perhaps more of those mass testing sites, federally run testing sites or the vaccination sites to help stop the spread, but also get people tested? We know that the administration is planning to send out those rapid tests, but the PCR test, of course, is more accurate. So is there a plan to do more in some of those hard-hit states across the country?
Absolutely. So again, we're working with our states to identify what their needs are. You know, there's many parts of the country that have built up internal capacity across their states, but those areas that need that additional testing sites, we are available to set those up. We've been partnering with the Centers for Disease Control, and we are setting those up now, and we'll continue to do so, you know, as the states need them and as they request them.
Brian is going to have the last one.
Thanks a lot, Administrator. When you came on in April and FEMA's had mass vaccination sites that it's rolled out, I think that one of the questions is right now the President just announced that they're going to triple a stockpile of PPE, get masks out to Americans, and also try to expand the testing capacity and home test kits. did FEMA weight too much of its resources toward vaccinations, or should it have also been surging that capacity months ago in testing and PPE?
FEMA's role has always been to support our hospitals, our schools, and our public service agencies. We have been supporting them through the delivery and reimbursement for PPE, for the medical staff that we're sending out. That has not changed, and that support will continue. The additional support that's coming out for the general population is something that FEMA does not participate in, and those are the issues that, or the items that you're hearing are going to be announced and available to the general public later.
When it comes to testing sites, FEMA's rolled out public testing sites. Why not surge public testing sites 3 months ago in anticipation that there would be surges of variants?
Again, we're working with our states routinely, and we're hearing what their needs are, and we're basing our support to them on what they need. And so as they request additional assistance, that's when we come together and give them the assistance that they need.
Thank you, Administrator Criswell. Appreciate you coming. You're
Thank you,
always
Jen.
welcome and invited.
Thank you. Thank you, everyone.
Okay. I know, again, we have short time here, so I just have 2 items for you at the top. Since President Biden signed the bipartisan infrastructure law 60 days ago, the Biden-Harris administration has hit the ground running to deliver results. We've made key progress toward implementing the largest long-term investment in America's infrastructure and competitiveness in nearly a century. The Department of Transportation today announced a historic investment under the bipartisan infrastructure law to modernize, repair, and replace approximately 15,000 bridges nationwide. That's a lot of bridges. This is the single largest dedicated bridge investment since the construction of the interstate highway system, and provides more than $27 billion to states and tribal transportation facilities. Obviously, there will be more to come, and you'll hear the president soon. Another little bit of news for all of you, and we'll have more in the week ahead, I expect, in the coming days. But next Wednesday, the president will hold a formal press conference at 4 p.m. in the afternoon. So we look forward to seeing you there, and the president looks forward to speaking directly to the American people. I'm going to try to go to the people who didn't get questions and then come back around if that works. So go ahead.
I wanted to follow up on the cyber attack against the Ukraine.
Yeah.
I know the NSC said it was too soon to attribute the attack, but could you say where early indications are pointing?
Well, let me first say that because I know there's been a lot of questions, understandably, on this. So let me try to address a few of them as well, if that's okay. The United States and our allies and partners are concerned about this cyber attack, and the president has been briefed. We are also in touch with the Ukrainians and have offered our support as Ukraine investigates the impact and nature and recovers from the incidents. We don't have attribution at this time, and I can't point to any more specifics. I know the Ukrainians also announced and conveyed that they got their systems up and running pretty quickly and that personal data was not accessed. We will continue to, of course, work with them and assess any additional impacts. We're continuing to consult with allies and partners, including Ukraine, on this. You might have also seen NATO's statement as well, which says that they are also exchanging information with Ukraine. So that's where the status stands right now. I think it's important to note the Ukrainian statements on this, which convey very, very clearly that they were able to get their systems up and running.
If it is determined that Russia was behind the attack, how would the U.S. respond to that?
I'm just not going to speculate on that or preview what actions we would take at this time. I would just note that we will take necessary and proper steps, of course, to defend our allies, support our partners, and support the Ukrainian people, but we're still assessing that at this point in time.
Could you describe in a little more detail what sort of support the U.S. has been providing Ukraine on the cyber front, like over the last few months?
I'm happy to check with our team and see if we can detail that more to all of you specifically. We have been in touch with them, working with them on many levels, and certainly the threat of cyber attacks is something that has impacted a number of countries throughout Europe, throughout the world. We've providing, of course, best practices, the expertise we have in the U.S. government, but I can see if we can detail that more specifically. Chris, go ahead.
I know there have been some challenges this week, but zooming out kind of even more, what's your message to Democratic voters out there who said they voted for lawmakers to protect voting rights, turn the tide on global warming, lower prescription drug prices, reform police departments, raise the minimum wage, tackle student debt, and have gotten none of it?
Our message to them is that we're still fighting for absolutely every component of what you just listed. And that right now we're dealing with the realities of the fact that we have a very slim majority in the Senate and in the House. that makes things more challenging than they have been in the past. I would also note, and I bet a lot of Americans who have conveyed their advocacy for a lot of those issues the president cares deeply about, have also cared deeply about getting the pandemic under control, have also cared deeply about ensuring schools are open across the country, that small businesses are functioning, that our economy is up and running. And those have been the top issues basically in every piece of data we've seen across the board. So the message from the president to them is he is committed to continuing to fight. You heard him say this week that voting rights, the rights of people to express their views at the polls is something that is fundamental to him, and he's going to stay at it.
One last thing. Do you have any news for us on the president holding a formal news conference?
I just announced one at the top. Chris, we've just caught you. It's okay. I now relate to your teachers in high school and what they may have experienced, but it's okay.
I'll look for the media clip.
Yeah, there you go. To be fair, it is a Friday and a very busy news week, so everybody should take any pressure off of Chris. Go ahead. Yes, go ahead. And we have not met before, so welcome to the briefing room.
Thank you. Is the president planning any sort of staff shakeup or changes at the White House given recent setbacks, including inflation at a 40-year high, the Supreme Court blocking the vaccine mandate, and the collapse of voting rights legislation?
Well, I would say the other way to look at the last year is that 200 million Americans are now vaccinated. More than 80% of Americans have received at least one dose. If you look back to a year ago, only about 35% of people were willing to do that. Through the president's action and leadership, we have made vaccines available across the country. Boosters, we have provided more supply to the global community, 400 million doses, than any other country in the world. We've had record economic growth in this country. We have record low unemployment rates in this country. And we are getting out of a pandemic and the economic downturn tied to it at a rate that is faster than anyone thought would have happened. We have confirmed more judges that look like America, that are diverse like this country, than almost any other administration in history. And again, the truth is, an agenda doesn't wrap up in 1 year. We are going to continue to fight for every component of his agenda and his plans for his presidency that he outlined when he was running for president.
Can you confirm that a coronavirus emergency spending request is coming, and what details can you provide on that?
Well, we are always in touch with Congress and leaders in Congress about what needs the American people have as we continue to fight the pandemic. That has been the case continuously throughout the pandemic. And that remains the case today. I don't have anything to preview for you, but I would just echo what Speaker Pelosi said over the weekend, a couple days ago, where she said that we weren't going to let resources get in the way of fighting the pandemic. That continues to be our view, but I have nothing to preview at this point in time. But those conversations are ongoing. Go ahead.
Thank you. I have a couple of questions, and one from my colleague at VOA.
Sure.
My first question is, the administration's response as hundreds of nurses with the National Nurses United held demonstrations demanding for safer COVID conditions, and they talked about there's not necessarily a shortage of nurses, but many are not willing to work in what they feel like are unsafe conditions and feel like some of the protections are being weakened.
Well, I would say first that we believe there should be strict and stringent requirements in medical and in hospitals and medical facilities to keep the people who are working there safe and also to keep the patients safe. And I would just note that yesterday the Supreme Court continued to is allowing for the CMS requirement to move forward, which is an important component of keeping people who are patients safe, but also keeping workers in a lot of facilities safe. A number of hospital systems across the country have implemented vaccine requirements, which we certainly